Have you ever wondered what the food you eat actually does to your body at the cellular level? Why is it so important to have a healthy diet? Today, we are talking about how hormones shape women's health and how hormonal well-being can be supported with the right nutritional choices. In this video, the term woman is being used to describe biological females, as that is the same terminology used in the research utilized for this content. Biological females tend to live longer than males, but are more likely to deal with different types of health issues like migraines, hormonal disorders, and thyroid problems. Their immune systems are strongly built to support pregnancy and pass on protection to babies during breastfeeding. But that same strength increases their risk of autoimmune diseases like lupus and rheumatoid arthritis. Additionally, estrogen allows women to have increased flexibility with their circulatory system, allowing them to carry 20% more blood during pregnancy. This advantage allows them to decrease the pressure on blood vessels even when a higher volume is present, resulting in less damage due to high blood pressure compared to men of the same age. Furthermore, the nature of the menstrual cycle, which is dependent on hormonal fluctuations, has inflammatory patterns. This demonstrates relationships between phases in the cycle and non-reproductive health. For example, individuals may be more or less susceptible to infections based on what phase they are in their cycle, indicating that hormonal levels and changes are a key factor in one's well-being. Understanding the unique experiences and challenges of women's health and how hormones play a role in them gives us a better understanding of the big picture. This allows us to make better choices to support our systems inside, such as those related to diet and nutrition, as what we put into our bodies directly affects what happens inside. Polycystic ovary syndrome, otherwise known as PCOS, is a type of chronic hormonal disorder where individuals tend to have abnormal levels of hormones such as insulin, androgens, LH, FSH, and more. PCOS is a condition that affects millions of women worldwide. The age at which women are at higher risk of PCOS varies, but is most common in women between the ages of 12 and 55. This period is known as the reproductive age, the part of a woman's life where she is experiencing the most hormonal fluctuations and imbalances. During this time, women are also supposedly the most fertile. Although according to the World Health Organization, PCOS is known to be a leading cause of infertility, as A, reduced GH, increased LEAP2 levels, high LH basal, increased LH-FSH ratio. High androgens and low estrogen are demonstrated in PCOS and linked to infertility. PCOS symptoms include, but are not limited to, excessive hair growth, irregular periods, infertility, weight gain, and acne. Research shows that diets high in processed foods, like the typical Western diet, can make PCOS worse. In controlled case studies, it has been found that women diagnosed with this hormonal disorder were found to consume high glycemic index foods more regularly compared to controlled groups. Foods that pose as high risk factors for PCOS include foods with high sugar content, saturated fats, and food with high sodium levels. On the other hand, the Mediterranean-style diet with more whole foods, healthy fats, and veggies can help reduce the symptoms. Insulin resistance in women is closely linked to PCOS. Insulin resistance can cause issues like irregular periods and infertility issues. Women who have gestational diabetes during pregnancy are more likely to develop type 2 diabetes later on. Increased insulin, reduced GH, increased ghrelin, and leptin resistance result in an increased prevalence of diabetes and obesity in PCOS women. As women go through menopause, hormonal changes can increase the risk of insulin resistance, making it harder for the body to use insulin properly, leading to higher blood sugar levels that are more difficult to control. Moreover, the bacteria in your gut produces hormones like ghrelin, which controls hunger, and GLP-1, helping regulate metabolism and insulin secretion. A diet high in fiber and probiotics support healthy gut bacteria, which in turn helps keep your hormones balanced. The thyroid has many functions within the human body. It regulates energy, metabolism, internal temperature, skin, nail, hair health, and overall homeostasis of the body. It does this by producing hormones thyroxine, T3, triiodothyronine, T4, and calcitonin. T3 and T4 are produced from follicular cells within the thyroid, while calcitonin is produced via the parafollicular cells. Iodine from our diet is combined with tyrosine and amino acids within the thyroid to then produce T3 and T4 hormones. That means that our diet has a direct correlation to the health of our thyroid. Nutrient-rich foods and even basic nutritional education is proven to help women manage these conditions and their symptoms more effectively. Hormonal disorders such as hyperthyroidism and Hashimoto's disease can alter the thyroid, limiting it from functioning in a way that is vital for our health. Hyperthyroidism is an overproduction of thyroid hormones, while Hashimoto's disease is damage to the thyroid that causes underproduction of thyroid hormones. Your thyroid needs nutrients like iodine, selenium, and zinc to function effectively and maintain the right balance of hormones as they help the thyroid produce hormones T3 and T4 and protect from damage. You get those from whole foods like fruits, veggies, and grains. But suppose your diet is full of processed foods. In this case, it can cause problems such as hyperthyroidism because processed foods often lack essentials such as iodine, selenium, and zinc, which are key for thyroid hormone production. So, what's the big takeaway? Women with PCOS have seen better hormone balance and more regular hormonal fluctuations by focusing on low sugar, high fiber foods. And similarly, for thyroid issues, eating nutrient-rich foods that support thyroid function can improve energy and overall hormone health. It's all about small, consistent changes that lead to meaningful health benefits. Thank you.